So Sally, we're about to see Taylor. What do you know about her?
I know that Taylor is a 6-month-old baby girl born via vaginal delivery at term after an uneventful pregnancy. Her APGA scores were normal and her healthy hearing screen was also normal. She's been referred to physiotherapy from the Paediatric Registrar for assessment of developmental delay. Taylor was admitted to hospital from ED 4 days ago for investigation of failure to thrive. She has a history of poor feeding, weight loss, dehydration and general irritability, and also recent coffee ground vomiting. She's booked for an endoscopy tomorrow for confirmation of suspected cow's milk protein allergy and related eosinophilic esophagitis.
Do you know what eosinophilic esophagitis is?
I'm not really sure. I think it might be to do with the stomach, but I can go and look it up.
That sounds good. How about we talk through Taylor's history first, and then you can go and have a look. Are there any other symptoms that were documented?
Yeah, Taylor has had some history of diarrhea, cough and runny nose, but all tests show she's not infectious.
That's good. Are there any other teams involved for her hospital stay?
I know she's been to see gastroenterology and the dietitian, and today commenced on a new formula called Neurological Exam. The social worker has also visited and reports back that mum Cassie is extremely tired, anxious and having trouble coping with the hospital admission.
Do you know any more about her social history or her family situation?
I know Taylor is the first baby for parents Cassie and Jack. They live about 45 minutes away and Dad works full-time and Mum stays home with Taylor.
You've covered a lot there, which is great. Do you know she's on any medications?
I do know she's on a new drug called ranitidine, but I'm not sure what for.
Okay, well you can go look that up, and also the eosinophilic esophagitis. Do you want to go do that now?
Yeah, okay.
So Sally, what did you find out?
Well, eosinophilic esophagitis is an inflammatory condition of the stomach and esophagus caused by food allergy, and that's why she's been started on ranitidine. I think it inhibits the stomach acid production because she has blood in her vomit.
Okay, when do you think would be a good time to see Taylor today?
Well, the nurse's entry in her chart said that she had a bottle about an hour ago, so that should have settled in her tummy by now. And she hasn't had any vomits this morning. The nurse did also document that she pulled her nasogastric tube out this morning, but they aren't putting it back in until tonight.
Okay. Why do you think she has a nasogastric tube if she's having bottle feeds as well?
I read in the dietitian's entry, overnight they're giving her continuous NG feeds to improve her weight gain because she's below the 3rd centile in her age for weight.
Okay. Do we need to consider anything else when we're timing our visit?
Her ob's been stable this morning, so that's good. Probably just whether or not she's awake, I guess.
Sure. So Taylor's been referred to physiotherapy for developmental delay. What questions would you like to ask in your subjective?
I think I have most of the information from my chart, but in my subjective examination, I'd like to find out what Taylor's developmental history is like her motor skills and which areas mums are concerned about.
That's great. Now, thinking of your objective examination, what would you expect to see in a typically developing 6-month-old baby?
I looked this up this morning. So a 6-month-old baby should be able to keep their legs in supine, prop in prone, roll from back to front and front to back, start by sitting themselves and reaching for toys with both hands.
Okay, that sounds really good. How would you like to structure assessment with Taylor today?
Well, I'm not too sure if I could do a full assessment today because she might be irritable and she hasn't been sleeping that well. I'd like to do a neurological exam, maybe tone and clonus, because I read in the chart that the doctors felt she had increased tone in her legs and was arching her back a lot. I'd also have a look at her gross motor skills in different positions and maybe some of her play skills.
That sounds great. Is there anything else you'd like to look at?
No, I think that's all that is required.
Think more about the other systems now.
Maybe her hearing and vision?
Yes. Also, let's think about her vestibular, proprioceptive and postural control. We also haven't talked about her infant patterns of movement.
Yeah, that's a good idea also.
Okay, let's go and see Cassie and Taylor. I've already popped in and checked it's okay with Mum for you to do a student assessment today.
Okay. Hi, Cassie.
Hi.
This must be Taylor. She's a cutie, isn't she?
Yeah.
So my name's Sally, and I'm the final year physiotherapy student. And this is my educator, Jenny.
Hi, Cassie.
Hi.
So we've been asked to come and see you and Taylor today because the paediatricians noticed that there's a little bit of issues with her developmental delay.
Yeah, the doctor mentioned that the other day. I hadn't even realised she wasn't doing what she was supposed to be.
Okay, well we can have a look at that today. So our assessment shouldn't take more than 30 minutes, but if Taylor's getting a bit upset, we can stop.
Yeah, she has been a bit cranky, but hopefully she'll be okay for you.
Okay, that's great. So I can see from the notes that we may have an answer to why Taylor's had such difficulties with feeding, putting on weight, and she's a bit uncomfortable in her belly.
Yeah, the doctors think it's cow's milk protein allergy. I think she's got one more test tomorrow and then they'll be able to tell us more.
Okay, well that must be a bit of a relief to know that she might hopefully be feeling better soon.
Yeah, it'd be good to know, but I just don't know what it means and what I have to do for her.
Well, hopefully when Taylor's ready to go home and you have a little bit more information, you'll be able to be a bit more confident in helping her.
Yeah, I hope so.
So for now, let's just focus on how she's developing. Do you have any concerns?
Well, like I said, I didn't realise she wasn't doing what she was supposed to be doing. She's really good at smiling and when she's in a good mood, obviously. Sucks on her hands a lot and kicks in the bath. She really loves sitting, so I hold her up a lot.
So with her sitting, she does really like it?
Yeah, she does.
Okay. Okay, Cassie, well back to her tummy time. Have you tried doing this with Taylor?
I've tried her on her tummy, on my chest, on her tummy, and she just doesn't seem to like any of it.
Alright.
I don't know what's wrong.
Sally, can you think why Taylor might be finding lying on her tummy uncomfortable?
Because her tummy is a little bit discomforted.
Yeah, she's got some pain. She also might be a bit tired.
Yeah, okay, that makes sense. Well, we can have a look at that a little bit more today and try and make it a little bit more easier and more comfortable for Taylor, if that's okay.
Okay, yeah, that sounds good.
So I'll just quickly wash my hands. Would it be okay if we put Taylor in the cot today to do our assessment?
Yeah, sure, that's fine.
Alright. So I'll just...
She's a bit cranky and she might spew. Hopefully not.
That's okay.
Are you happy to leave her out for now because she's been scratching her legs?
Yeah, that's not a problem.
Okay.
Do you want to just come around the other side so you can watch what we're doing?
Okay, sure.
I'm just going to go grab some toys for her. Would you just mind standing while I go?
Sure.
Thank you.
Do you want to pack that in?
So we'll start with just watching how she follows some toys. So she seems to be following that really well.
Yeah, she looks for me all the time at home and she watches Jack when he comes in the door from work too.
So Cassie, I'm just going to have a look at her sitting now, if that's okay.
Yeah.
I'll just straighten her up a little bit.
Sally,
Yep.
is there another way that you can assess Taylor's sitting that will also help with your assessment?
Yeah, I could do.
Perfect.
Oh. I'll just get her to stand up a little bit as well. And Cassie, if you want to grab the rattle for her to play with, you turn her towards you.
Hey, darling. Hey, Taylor. Hey, darling. Hey, Taylor.
She seems to like sitting.
Yeah, this is her favourite position at home.
So I'm just going to have a look at her muscle tone and clonus, and then we'll go on to her belly.
Okay. It's alright, darling. She's getting tired.
Just hold it. Look at her arms. Oh, that's just... Does she have a favourite nursery rhyme?
She likes Twinkle, twinkle.
Twinkle, twinkle, little star, how I wonder what you are. Above the world so high. Now we'll just roll on to it. We go. Oh. There we go.
Okay, darling. Yeah, she
Doesn't
really
like
doesn't
being on
like
her
it.
belly, does she?
No.
Sally, what might be some reasons for this?
She could have some tummy discomfort. It might just be hurting her belly a little bit. Or it could be the pain in her belly, possibly allergy. She might not just like playing on her belly. Okay, so Cassie, if you're happy, we'd just like to take Taylor and try putting her in different positions in prone. Okay. So if I can get you to pick her up and just bring her down that side of the cot, and I'll bring the therapy ball over.
Hey, Taylor. It's okay. Here we go.
So if you want to have a sit,
Yeah.
could you just help me hold the ball?
Sure.
Okay. So if you want to place it to me, and we'll try her sitting first.
Oh, that's like fun. Oh, who's that, Taylor? Hey, darling. Hi. Hello.
She seems to be alright in the sitting position, so I
Yeah.
think I'll just move her onto her tummy now and we'll have a go at that.
Okay.
Let's just bring our arms through. Thanks, Cassie.
Oh, hi. Oh, that's the best she's ever done. I don't have a ball at home though.
You can get the therapy balls from the sports stores and everything. Do you think Jack could find one maybe on the weekend?
Yeah, he might be able to go after work or something. Yeah.
Sally, is there another alternative that we can still achieve semi-upright with Taylor and prone?
You could use a really soft pillow from home.
Okay, yeah, we can say that.
So do you want us to leave the ball here for you to have a go with Taylor? She looks a little bit tired, so maybe after she's had a sleep.
Yeah, okay. Yeah. Should I have a go or?
Yeah, do you want to have a go now?
Okay.
Alright, so just get you to hold her and we'll hold the ball still.
Yeah.
So you just want to put her onto her tummy.
Okay. Just like that?
Like bring your arms forward. Oh, that's really looking well, Cassie.
Okay. Oh, good job, Taylor. Oh.
Oh.
So she seems to be doing really well with this activity. Do you have any other questions or concerns?
No, I don't think so.
No? Okay. Well, would you mind if we came back and saw Taylor just before you left to do like a little bit of a follow-up and make some alternative arrangements so that we can still be doing this activity?
Okay, so she needs some more therapy, does she? More
Yeah.
physio?
Is it close for you to get here?
Well, not really.
Okay.
We don't live very close and I don't always have access to our car.
Okay. Well, what we can do is we can try and reach out to the local community physiotherapy services and see if there's one closer to your area, if that's all right.
Okay, that sounds good.
Yeah.
Yeah.
Well, thanks for letting us play with Taylor today. She's really cute.
Thank you.
Thank you. Okay, Sally, did the session go as you expected?
Yeah, I think so. I think what we covered, Taylor coped really well with. We covered the most important things of Taylor's development, which was playing in prone for today.
How do you think Cassie coped during our assessment?
Well, she was a bit tired, but she did well when we were playing with Taylor in prone on the therapy ball.
Bearing that in mind, is there anything you could provide Cassie so she knows what to do next time?
I could give her some handouts that explain and go through the positions that we went through today. There are also some pictures so she can see what they look like for when she goes home.
That's a great idea. What were your main findings from your assessment?
Well, I think Taylor had some mild increased tone in her legs, but she had no clonus. I'm not sure if that's significant or not.
That's okay. It's unlikely it was a neurological cause because she didn't have a velocity-dependent resistance to stretch, and she also didn't have any clonus. Taylor has done a lot of arching, and this is reinforcing strong extensive movement patterns of her legs. We should see it settle down as she becomes more comfortable in her tummy. So what else did you find?
Her rolling, playing in prone and reaching for toys are all delayed. She's not doing much kicking in her legs or in supine or grabbing her feet. She is sitting with support but not propping yet, so I think she's quite delayed.
Is there an outcome measure that you could use to quantify all of this?
I could do an AIMS assessment.
I think that'd be a great idea, so we have a baseline measure we can compare it to. Is there anything else you weren't able to do today?
Yeah. I'd like to assess her sensory system, infant movement patterns and postural control.
And what about your other treatment goals or strategies?
I'd like to see if I can get her starting to play with her feet and improve her rolling. Maybe I could go back tomorrow and do this.
That sounds like a good plan. What else do we need to arrange for Taylor?
Well, I'm not sure what local physiotherapy services are available. Would you be able to help me organise something for them?
That's not a problem. We have a list of local physiotherapy services back in the office.
Okay.
Are you going to finish up her notes from today so we can get them into a chart?
I'm almost finished, and then would you be able to check them first if that's okay?
That's fine.
Okay.